Is it good now? Yeah, okay, thank you so much. Alrighty, so like I was saying, the axial muscles, the trunk muscles, they're organized in a really nice way for us to identify some patterns in their location mostly, but we also decipher their patterns based on the different regions. So first we have the epaxial muscles, and there's only 3 of those. We'll talk about them really briefly, but those are our back muscles that lay right on our spine and our vertebrae, and those are going to be depicted in red in these 3 diagrams. And then we have our hypaxial. So when you see those 2 words, and it's going to come up in a few poll everywhere questions, so epaxial is going to be just those 3 back muscles, and then everything else is a hypaxial muscle, okay? So all of this, everything, if I were to shade all of this area right here, that would all be hypaxial. So hypaxial includes our ventral, includes our ventral, our lateral, and our prevertebral muscles. Prevertebral muscles are really strange, I think, in a way, because we can't even palpate them. They're below and behind everything. So like if you were to feel your neck right here, right? So it's going to be behind that, but it's going to be in front of your vertebrae. So you can't even feel it. It's kind of hard to imagine, but these transverse pictures that we take of these sections really help us to understand. So if you can see these purple, they're going to lie on top of our spinal cord. But this, of course, is our anterior, and this is our posterior view of the body. So keep that in mind as we're going through the lab as well. And this picture from your lab text, you all know this is going to be the neck region. So it's sliced right here at the neck. This is going to be sliced right here at the thorax, and then we have the abdomen. Okay. And then the other really important thing about the axial muscles, oh my gosh, bringing it back to spinal nerves, right? So that was lab 1. These are going to be innervated by the spinal nerves. I don't think we have any muscles that are innervated. Nope, I don't think we have any muscles that are innervated by any cranial nerves. So all of this is spinal nerve innervation. And I think that's right, Annie, you can correct me if that's wrong. Or any of you correct me as we go along. Okay, so we'll first start with our epaxial muscles. So remember, these are just those 3 muscles in the back, epaxial, and they're going to be present in every single section. So as you can see in this picture, we have the neck region, we have the thorax region, and then we have the abdomen region. So I'm mentioning it now as its own category in terms of the, the hypaxial, the ventral, the prevertebral, and the lateral. But I want you all to notice that it's going to be coming up in every region of the body that we're going to talk about. So we'll talk about it once here, and then we'll kind of let it be. So we have, I'm going to do this one first. So this is the transversospinalis group. You can see there are these tiny little muscles that just connect 2 spinal vertebrae. And they're going to be very deep. They're going to be almost touching. They're going to be the ones that are touching our spinal cord, right? So they're going to be very, very deep in our layers of our back muscles. And they're going to help us to rotate our back. So can everyone just go ahead and give yourself a rotate? That's going to be your transversospinalis. Right? And we also use our transversospinalis to help with our posture. Okay, and then we have our 2 more superficial back muscles. The first one is going to be our erector spinae, and we don't really, we very loosely categorize where this muscle is found in relation to the splenius. So the erector spinae is loosely the lower 2/3 part of our back, our spinal vertebrae, sorry. And our splenius is loosely that 1/3 upper region. Okay, so as you can see here, this erector spinae is going to span many vertebrae, and same thing with the splenius, it's going to span many vertebrae. So it's very different from the transversospinalis, which only spans 2 vertebrae, right? So we have several vertebrae spanning versus 2. And the erector spinae is a very bulky muscle, as you can see, and so it helps us to do some very important movements. So go ahead and let's try this. So the erector spinae helps us to, when it's working bilaterally, so both sides of the erector spinae, the left side and the right side, bilaterally are going to help us to extend our back. So go ahead and extend your back. Oh, I feel like this is kind of getting a stretch in. So that's extending our back, right? And when we were talking about all the joints, extension and flexion, we were categorizing it by saying that flexion was reducing the angle and extension was increasing that angle. Here it's a little weird, right? But just know that extension for our torso is going to be going to the back and flexion is going to be coming to the front. So here's that little diagram to show you that. So again, this erector spinae and the splenius, they are shortening, extending our back. Okay, cool. And then we also have another motion that these two help with, and when they are unilaterally working, right? So if I said bilaterally is both sides, what's unilaterally?
When it's only one.
One side, exactly. So just the right side or just the left side. So if just the right side is contracting, I'm going to be arching my back this way, and we call that the lateral flexion, okay? So just the right side, or just the left side, that'll be my lateral flexion to the left side. Okay, my back feels pretty stretched out from that, but those are the three movements that we do from these epaxial muscles. Okay, great. Any questions on that? Move on. All right, so here's when the material gets a little bit dense. I know there are a lot of muscles, but if you just keep everything in its little categories, you should be fine, all set to go. If you're following along with me, we've already done the epaxial muscles, so now we're starting the neck muscles right here. Okay, so we've done the red. We don't have to worry about that. All we have to learn now is these four muscles for the neck. And so we have the prevertebral, the lateral, and the ventral group all present in the neck. And we can see that in this picture right here. The gray, again, is going to be our visceral organs, like our trachea and our esophagus. And I want to note as well, this red muscle right here and this red muscle right here. Does anyone know, they're on the slide, but does anyone know which muscles these are?
Trapezius.
This is the trapezius, and then what about this one?
Sternocleidomastoid.
Sternocleidomastoid, exactly. So does anyone remember what we talked about last week with these two muscles? Anything about them that we remember?
They help move the neck.
So which one helps move the neck?
The sternocleidomastoid.
The sternocleidomastoid, that helps to move the neck. The trapezius also helps to move the neck. Do you remember how?
It's in charge of like moving with the scapula, with like retraction and elevation.
Yep. So the trapezius is that scapula movement. And remember, it was a bulk of the scapula movement. It went, it elevated, it retracted, it depressed. But if you remember, we also said that it laterally flexed the neck. So the trapezius is there doing some neck movement, but we don't consider it to be one of these axial muscles. So just remember, this is not part of the neck muscles. This was part of what we were talking about with the scapula movers. The trapezius is not going to be part of the neck muscles when we talk about axial muscles. And the same with the sternocleidomastoid. And another distinction between these two muscles and the muscles of the neck that we're talking about, these groupings. Does anyone know another distinction? And it has to do with nerves, if that's a hint.
Innervated by the spinal accessory nerve.
Yes, exactly. Thank you so much, Emma. So remember that the sternocleidomastoid and the trapezius were innervated by the spinal accessory, by CN11, right? So these are innervated by cranial nerves versus these neck muscles that we're talking about. They are innervated by opposite.
Spinal nerves.
Spinal nerves, exactly. So those are two different distinctions. Just make sure that when you see, lab materials from 5 and 6 mixed together, you're keeping that separate. Okay, so we have these three groupings here. We'll just run through a few pictures and talk about these muscles. So like we said, the prevertebral group, you can see it right here. So these are which muscles?
Your longus capitis and longus colli.
Yes, longus capitis and longus colli. So here we have the longus capitis and here we have the longus colli. And again, they're going to span the vertebrae, but on this anterior portion, but a portion that we can't feel because we have our trachea and our esophagus in front of it. Okay, and then we have our lateral muscles, which is what? What are the lateral muscles called?
Scalene.
Scalenes, yep. So these are our scalenes. Sorry?
Sorry.
Oh,
Is
you're
it
good.
inferior and superior, infracostal or something?
Say that one more time.
For the lateral muscles, is it like infracostals?
Yeah, so infracostals, that's going to be actually in a different region. So Dee Dee, hold that thought for 1 minute
Okay.
until we get to the thorax. But remember, we're just talking in region. So we're just doing the neck right now.
Okay.
But we'll get to that in a second.
Okay.
So lateral is going to be scalenes. And actually, that's a really great example of how these groupings actually help us to understand what's going on. So I'm grouping it, and I think the lab text does very similarly, grouping it by region. So we said neck, thorax, abdomen, and then also grouping it by, is it epaxial, is it prevertebral, is it lateral, or is it ventral? So keeping these groupings orderly and systematic will help you to make sure that you know which muscles are where. Okay, and then lastly, we have these muscles right here. What do we call that?
Infrahyoid muscles.
Yep, infrahyoid. Thank you so much. And I believe we had a question at one point about this bone right here, and it's a bone that's not attached to any other bones. What would that be?
The hyoid.
The hyoid. So now we can see how the hyoid actually moves as hyoid muscles. Alrighty, perfect. Let's move on. Okay, so the next grouping we have, so we just did the neck region, now we're going to go to the thorax. So the thorax is really unique in that it actually doesn't have any prevertebral muscles, and it rarely has the ventral muscles. And I say rarely, and I'm going to just mention this right now, I say rarely because it sometimes has this muscle called the sternalis. Sometimes it's present. At the moment, it's just a vestigial structure anyway, so if you have it, it's really not contributing any function to you. So when we look at the thorax, in general, we say that it has only the epaxial groups and the lateral groups. So just like Dee Dee was saying, we have a lot of intercostals at this point, and we know that intercostals have to do with between the ribs. So these muscles that are all laid out between the ribs and help us to protect our thoracic viscera. Okay, so here are some pictures. I don't know why they're very blurry, but these are from the lab text. And we'll start up here with the serratus posterior superior, which is going to be right here, and the serratus posterior inferior, which is going to be down here. Can anyone name one muscle that this serratus posterior superior looks really similar to, that they might remember? Does it look really similar to?
Is it the
Rhomboids.
The rhomboids, yeah, exactly. And the lab text mentions that as well. Those are one of those key pieces of information that sometimes we miss, but just keep in mind, these do look very similar to the rhomboids. Now, how do I distinguish between the rhomboids and the serratus posterior superior? Any ideas? Can we see the rhomboids in this picture? Am I seeing some no's? I think Emma saw no. Okay. So we cannot actually see them. Does anyone know why? They're not pictured.
Does it have to do with like the different layers of muscles?
It does, exactly. So the serratus posterior superior is going to be deep to the rhomboids. So just like Caitlin said, if we added another layer on top, then we might see the rhomboids. So the rhomboids are going to be more superficial. If you were to see a picture where two muscles were stacked on top of each other, hint, hint, and one was deep and one was superficial, then you would know which one is which. And I believe, just from my observations, the serratus posterior superior looks more finger-like. The rhomboids looks more, like a flat plane. And that's another way that I use to identify them. Okay. So we have those two, and we also have right here, like Dee Dee was mentioning, our intercostals. So we have the external and the internal intercostals. This picture, again, I'm so sorry, it's blurry, but it's the same picture in your lab text. So if you're following along, you can maybe look at that. And it's kind of hard to see anyways, even if it wasn't blurry, but if you can see, there's two different layers. So they've cut the layer right here between the ribs, and again, right here between the ribs. So this layer right here is actually going to be on top of this layer. So that makes this layer what? If this layer is on top of this layer, which intercostal is it?
External.
External. Exactly, yep. The external intercostal. It's going to be on top of the internal intercostal. And they are very appropriately named, right? We can see that they are just directly between the ribs, which we know intercostal means between ribs. Okay, and then with what Dominic said, by that logic, that makes this inner layer, that's this layer that's below this layer, and this layer that is in this view above this layer, the internal intercostals. Okay, so this might be a really good muscle for you all to make a complete anatomy screen for and just really look around at the views of it, cut things a little bit and dissect things and see what the different views look like so you can identify internal and external. And then lastly, we have the transversus thoracis. I think that's a mouthful to say, but the transversus thoracis is going to be right here, and it's going to attach to our sternum. Okay. Do we have any questions on that so far? Nope. Okay. One quick question, just to make sure everyone's doing all right. Does anyone know what the main function of all of these muscles is? Is it to rotate our spine? Is it to reach up and down? What's the main function of all these thoracic muscles?
Ventilating the lungs.
I heard something about lungs. Ventilating the lungs, exactly. It's for ventilating the lungs. So all of these have that same function. And as we talk a little bit more about respiration, we'll talk about that I think in lab 7. We'll talk about how when we expand these muscles, we're really opening up that cavity. So these muscles are important for breathing. Okay. Next, we have, of course, the abdomen muscles. So we just did the neck, we did the thorax, and now we're moving to the last section, which is our abdomen muscles. So these muscles are really important for a lot of different things. If you have heard of any workout ever, people always talk about abs. Well, we're going to talk about our ab muscles and the abdomen muscles. These muscles are also used for forced expiration. So you force your expiration out, defecation, of course, and childbirth. But any of that squeezing motion in our abdomen. And these have to be really, really strong muscles too, because we have so many internal organs, so they really have to help to protect that. So we have so many layers when we look at these lateral muscles that are going to assist with that expiration, that defecation that we have to do as people. Okay, so epaxial, that's a given. If you notice here, we have left out the splenius because we're in the lower section, we're in the abdomen, and the splenius we said was in the upper third. So just keep that in mind. Same exact epaxials, we just don't have the splenius because it's just not in that region. Okay, and then the prevertebral is going to be the psoas major and the quadratus lumborum. Let's see that. Okay, so the quadratus lumborum, I think it's a really strange name, but what it does help me to identify is that it's a quad, so a 4-sided muscle maybe. I think this kind of looks like some kind of 4-sided figure. And it's on the lumbar side, right? So my back side. That's how I remember that muscle. And then we have our psoas major. It's a funny muscle right here. Okay. Does anyone remember something about the psoas major and this muscle right here? This grayed out muscle. This is just for bonus points, just to see how we're doing the lab text.
It creates the iliopsoas muscle.
Iliopsoas. So what muscle does this make? Does that make this?
The iliac. Ilias.
Very close. Iliacus. Yeah, very close. So exactly right. So the psoas major and the iliacus join and form the iliopsoas below what we call the inguinal ligament. We'll talk about that a little bit more in a second, but that's just something to know right now. Okay, in our lateral section, we have the external oblique, the internal oblique, and the transversus abdominis. Notice the pattern here, external, internal transversus, external, internal transversus. So notice that pattern. Of course, we're talking about the obliques and the abdominis here. And really the most important thing that you would be expected to know for these muscles right here is, of course, what they're used for, but also their directions. So the direction of the striation of the muscle. So the transversus abdominis, is that going to be the deepest muscle or the most superficial muscle out of these three? Is the transversus abdominis going to be the deepest or the most superficial?
The deepest?
The deepest, exactly. This picture kind of shows that in the way that these muscles are layering on top of each other, right? But the transversus abdominis is going to be the deepest muscle, and its striations are going to be just horizontal. Nothing really to that. You can think of the transverse plane, and they're going to just go straight. Okay, for the internal obliques, they're going to be a little funky and they are going to, face this weird way. I don't like to remember the internal obliques because they're just kind of hard for me to remember. But a way that you can remember the direction of the external obliques and therefore remember the direction of the internal is if you take your hands and you put your hands in your imaginary coat pocket. Yep. And if you put your hands in your imaginary coat pocket, your fingers are now pointing in the direction of the external obliques. And remember, you would put a jacket on top. That's going to be the most superficial layer. If that helps you remember it, great. If that was a lot of words, don't worry about it. The point is, your external obliques go down like this, and your internal will go this way. This is very hard for me to do and for me to remember. External go this way. Okay. And then the last muscle we have, like I said, everyone always talks about their abs when they're working out. These are those quote unquote ab muscles, our rectus abdominis. And here this skeleton has a 10-pack apparently. So there you go. Any questions on that? Good. Hopefully good. All right, so now at this point we have a full sheet of our axial muscles. We have all of our trunk muscles laid out. Does anyone have any questions on any of the trunk? No. Any questions on how it's organized? Nothing at all. Okay, we'll keep moving. I think we're ready to start some pull everywhere, if I'm not mistaken. Yep. All right, so pull everywhere. This time I set 1 minute, so hopefully that'll be enough time for you all to pull up pull everywhere. I'll stop the poll if I don't see enough people, but go ahead and start answering this question. All right, I'm just waiting on 2 more people. We got about 15 seconds. Okay, all set. So let's see how we did. Oh, wow, that's awesome. So which of these muscles is the epaxial muscle? Looks like we don't even have to discuss that. So it's definitely the erector spinae. Like I said, there's only 3 of them. And I think the next question talks a little bit more about that. So go ahead and try this one. I don't think we've ever seen 96%, have we? Nice job. Okay, so let's see how we did on this one. Oh, I'll open it up for a few seconds for those 2 people who didn't get your answer in. Go ahead and get those in. Alrighty, so which of these is a hypaxial muscle? So we talked about this in the beginning, epaxial versus hypaxial. So epaxial is going to be 3 muscles and they're actually on the screen, and then hypaxial is everything else. So which of these are the epaxial muscles? Where you already said, I believe I think it was the erector spinae was already on the other slide. And of course, we know the splenius is an epaxial muscle and the transversus spinalis. So the correct answer is going to be transversus thoracicus. That is going to be our hypaxial muscle. Are there any questions on this question? No? So just really quickly so that we make sure we nail it in, what are our 3 epaxial muscles?
The 3 that are listed down there.
The 3 that are listed down there, great. And what are our hypaxial muscles?
The rest.
Everything else, everything else. So that is the only distinction you need to know between those 2. That should be pretty good. So hypaxial is everything else, epaxial is those 3 listed. You see those words ever again. So which muscle of our epaxial, let me do this.
transversus spinalis.
Exactly. Transversus spinalis is going to be our deepest muscle. It's only going to span about 2 vertebrae, and it's going to help me to rotate. Which muscle or muscles helps me to laterally flex my back? Sorry, extend my back.
Rector spinae.
Erector spinae, and if I was flexible enough and I could throw my neck back as well. What else is helping?
The splenius.
Splenius, yeah. So those two, remember, can help us to extend our back. Now, what if I were to say unilaterally flex? Which muscles help me to do this? Face you all. Which muscles help me do this?
The same two.
The same two, exactly. All right, I think we're getting the hang of that. We're ready to jump into case 1. Hopefully it shouldn't be too bad. Any questions on the directional terms? Because even I was getting a little mixed up in saying them, so hopefully I didn't confuse you all too much. Any questions on the directional terms of these muscles before we jump into this case? Because that will be important. Well, you know what? I should have done the groups before this. That was silly. Gosh. Okay. No worries. We have patience for technology. We like the technology. Okay, let's try this. Groups. Okay. And I am so sorry. I do not have my list with me, which I was told myself to make. So I'm going to need to get everyone's group really quick. So let's just go ahead and start with Dominic. Who was in your group, Dominic, for last week? Anyone in Dominic's group remember being in Dominic's group?
Yeah, it was me, and I think the 2 Brandons that are in this class.
Yeah.
Okay. Thank you. Okay, let's do Kyle. Who's in your group, Kyle?
I don't really remember who was in mine.
Anyone remember being in Kyle's group?
I think I was in Kyle's group.
Who is I? Nivi, can you say names?
It was Millie.
Millie and Nivi, okay, and then who else?
Sydney was in that group.
Sydney, thank you. Okay.
Wait, I was in Dominic's group.
And sorry, I can't see anyone right now while I'm doing the groups.
Oh, Nivi was in Dominic's group.
Nivi was in Dominic's, okay. No problem. Was anyone else with Kyle? No? Okay. Let's do Allison, who's in your group.
Caitlin, I think.
Caitlin, Emily.
Caitlin, Emily, Katie,
And then
Julia. And Julia Logan.
Mm-hmm.
Okay, perfect. What about Andy? Who was in your group?
No idea.
Anyone remember being with Andy?
I think he might have been in my group.
Kyle, okay. All right, we'll put you there, Andy. And who was with Ashley?
I think we had Emma and Presley, and
Okay.
maybe one more, but I'm not sure.
Gospel.
Gospel, okay. Anyone else? All right. What about Dee Dee? Who was in your group?
Gretchen,
Uh-huh.
and that's all I remember.
Gretchen, you remember anyone else?
Nicole.
Nicole. Who else?
I was in that group. Josh.
Who's that? Josh, okay.
Nicole, me, Joshua, Faith, and Dee Dee.
Faith, okay. Thank you. And who just messaged Lauren? Okay. All right, Lauren, you were in Kyle's group, you said? All right.
Yeah, I was with Kyle.
All right, and then let's see, we did today's group. And then I guess that means, was F.A., Matt, Nicholas, and Sophia, were you all together?
Yep.
Yes.
All right. Okay, perfect. There we go. So take about 10 minutes on this case and come back around 6:06 and we'll discuss. Coming back in to the group. Thank you all for your patience, everyone who finished early. We had quite a few questions on 1. So once everyone jumps back in here, we'll talk about question 1. So if you know what's up with that one, get ready. I'm going to ask you some questions. Okay. Alrighty, so we're all back. I stopped by everyone's room to make sure that you all are actively talking, and I saw a lot of active talking. So thank you so much for doing that. I really hope that you're getting more comfortable talking to strangers through a computer. I know it's not ideal. I also have to do it in some of my classes, and I'm like, why? But I really hope that talking about these answers helps you to understand the nuances of the question, where you're getting tricked up, and just understand the questions better so that it's better practice and more effective. Okay, so like I said, lots of questions on question 1. So let's go ahead and talk about that one. First off, let's read the question really carefully and determine what we're trying to look for. So it says that this patient was hit in a car accident by another car from behind. And we know this type of injury could be called whiplash, right? The head went forward and then it went backwards. And so we're trying to figure out what muscles kept the patient's head from too far overextending. Now, before we go any further, I just want to clarify this wording because me and Annie discussed this as well. It is a little weird wording to say overextending, and I think a lot of times we don't think of doing too much of the extension motion as called overextending, but that's literally what it's translating as. It's overdoing the extension motion. I could have written overflexion or overflexing, and that would be doing too much of the flexing motion, right? So overextending is when my neck goes too far back, and overflexion would be when my neck goes too far forward, okay? So that's the first thing I just want to make sure everyone's clear about and understanding in that wording. Now, with that being said, can anyone walk me through what type of muscle we are looking for? Not the names of the muscles, but just based on what we know about this case and the muscles, the type of muscles that we're looking for, what are the classifications? What are the types of motions? What are the regions? Any type of clues that we can use?
So they will essentially flex the neck.
Flex the neck, exactly. That was very eloquently said. We are looking for something to flex the neck. And the reason for that is, and bear with me with my hand motions here because I don't have a mannequin in front of me, but pretend that this is going to be my face and this is going to be the back of my neck, okay? So my right hand's back of my neck, left hand is my face. And these are the muscles that line up. And we're lining them up because we know that we have antagonistic pairs of muscles that do antagonistic motions. And just like F.A. said, if we're trying to look at extension, the antagonist of that is flexion. So here's our flexion and extension, okay? Again, anterior, posterior, here's our flexors, here's our extenders. So if our neck goes too far back, so this is like my neck thrown back, my neck goes too far back, what's keeping it in place from going too far back? These two have to be very parallel. And like F.A. said, it's the four-letter word, starts with an F, ends in an X, has an L and an E in the middle.
Flexion.
These are our flexion muscles. Yes, our flexion muscles act like a rubber band to keep in place those extension muscles. So if my extension muscles didn't have the flexors to act as the opposite motion, if this was not here, they could just flop all the way back as much as they wanted. But this rubber band of my flexion muscles helps to keep it in place. And we can talk about the opposite situation as well. We can say, well, we want to prevent my neck from overflexing, from going too far forward. And here are my flexors, and they're like, see ya, I'm trying to go this way. And these guys are like, buddy, you can't go that far. I'm here to hold you back. So our extenders are going to hold back our neck from overflexing. So you see these antagonistic pairs of muscles. So now we know we're looking for muscles in the neck that flex. Okay, so there's not that many of those muscles in the neck region that flex. There's 4 of them specifically. Can anyone help me figure out which ones they are?
Coli and capitis.
Longus, capitis, and coli. Capitis, however everyone's saying it, is fine. Just make sure you're spelling it correctly. And what else?
The scalene and sternocleidomastoid.
Okay, so why scalene? I thought that helped to laterally flex. What are you thinking, Sophia?
I was thinking that it like flexes it, so that's all I have.
That's all you have. That's completely fine. So we have this flexing here. We have this portion of flexion that the scalenes do, but we also know that the scalenes are this lateral muscle. Well, funny fact, the scalenes, like some of our other muscles we talked about, like the trapezius, they have several different insertions. So we have a little bit of an insertion in this anterior scalene. Annie and I were talking about this as well. You don't need to know anterior scalene specifically, but we've talked a lot about different regions of muscles. We're able to name different regions of muscles. So we can call this the anterior scalene. We can call this the lateral scalene. And maybe if there was, I don't think there is much of a region in the posterior side, but we could call that the posterior scalene, right? So the anterior scalene is actually going to be what's doing the flexing to help prevent that overextension.
Okay, thank you.
Aha moment. And then
Yes.
you said the sternocleidomastoid. So can you tell me about that? Or anyone else? Talk to a few groups about it, so I know you all know. What do you know about the sternocleidomastoid? And this is a throwback. I'll give you that. This is from last week. Yep, there we go. Cough lab at 5. Cough. Yeah, exactly. What is the sternocleidomastoid responsible for? Someone knows. I know someone knows. Sophia, who else was in your group? Let's see. Nicholas, right? Where's Nicholas? You got an answer for me?
Well, it's on the side of the neck and it can flex.
It can flex. It can flex. Exactly.
Yeah.
It can flex the neck. Perfect. So the sternocleidomastoid also flexes the neck. Just keep in mind, we're talking about it right now because, you know, when we do a quiz, we're not going to say this material is from lab 5 and this is from lab 6. That's not how it goes, right? But the sternocleidomastoid is not an axial muscle. Okay. It is not part of our axial muscles. It is innervated by a cranial nerve. It is on the more superficial layer. It is not an axial muscle. All right, but it is going to be a muscle that helps us to flex our neck and therefore prevent overextension. Does that help clarify that question up? Because I know a few follow-up questions, a few people said, well, why does it only say hypaxial muscles? Because I was thinking it was going to include some epaxial muscles. Well, now we know, right, the longus capitis and the longus coli, what hypaxial group are those from? I'll give you 3 options. 1 is prevertebral, 2 is lateral, 3 is ventral. What group are they from?
Prevertebral.
Prevertebral. And what about the scalene?
The lateral.
The lateral, exactly. So those are going to be hypaxial muscle groups. So that confirms that we have the right answer. And again, which hypaxial group is the sternocleidomastoid part of?
Would it also be the lateral?
Nope, not the lateral.
No, it's not a part of the axial muscles.
Not a part of the. It's not a part of the axial system. Exactly. It's not a part of the axial muscles. Great. So it's not going to be part of the hypaxial or the epaxial. It is not an axial muscle. Okay. We feeling okay about the questions 3 and 4? Is there any questions on that we can clarify? All right. Sounds good. We'll keep going then. Okay. So here's the fun part. We're getting into some things that look a little bit more familiar because of the parallel muscle structures that we can see in the upper limb and the lower limb. So of course, we always compare the hips to our glenohumeral joint. And we already talked about a lot of these different motions as well. And you're going to see that some of these muscle groups also resonate with the muscle groups in Lab 5. These are some parallels that you should be making, some patterns you should be identifying. So let's go ahead and get started by first just identifying the motion. So this should be easy peasy from Lab 4. What are the motions of the hip? So what is this green motion? What do we call that? All I'm asking you to do is just read what the
Isn't it external rotation?
external rotation, exactly. What about this one?
Internal rotation.
Perfect, thank you both. What about this red one?
Abduction.
Abduction, perfect. What about this one?
Adduction.
Exactly, adduction. What about this purple one?
Extension.
Extension, great. And you might have been able to identify that. This angle looks a little strange, but there's lots of things we can use to identify that, right? We're seeing the fibula right here. We're seeing the patella on the anterior side. We know this is the posterior side. Extension. What about this one?
Flexion.
Flexion. Great. So that was easy, right? Not bad. But now we have to add all these muscles to their motions. So here, of course, is a list of these muscles to their motions. But we're going to go ahead and break them down. Again, blurry. I don't know why. But these are pulled from the lab text. So if you just want to follow along with that, if that is clearer for you to see. So we'll first start with the flexors. So we have this tensor fascia lata, and that is going to be this muscle right here, assisting with flexion. One thing about the tensor fascia lata that I think is important to note is that it is part of this large band called our iliotibial tract. It kind of just merges into it. But notice how this tensor fascia lata is on the anterior portion. So always when we think of muscles, we're always thinking about shortening the space between the attachments, right? We're shortening the space between this attachment and this attachment. It's going to flex the muscle, move it forward like this, flex the leg, sorry. When we can look at the gluteus maximus on this picture as well. It'll be extending, same concept, this huge bulk of muscle. The insertion is going to be right here, pulling back towards the origin, extending the muscle. So the gluteus maximus is our only extender, but what is our other flexor that we have? Other flexor other than the tensor fascia lata?
Iliopsoas.
Iliopsoas, exactly. So we have the iliopsoas, which is a really cool muscle because it forms from two other muscles. So we have the iliacus, which is going to be originating in this iliac crest, and then we have the psoas major, which we talked about from what region of the axial muscles? What region did we notice the psoas major in? Referring back to our notes. Would it make sense to be the neck? No, not the neck. What about the thorax?
No.
Nope, not the thorax. So what does that leave?
The abdomen.
The abdomen, yep. So this is going to be one of those abdominal muscles, right? But below what we call this inguinal ligament, so it's a ligament, not a muscle, below it, we form this collection of these two muscles that we now call the iliopsoas. And these muscles will, let's see. So the iliopsoas muscles will both insert the iliacus and the psoas major, forming the iliopsoas. They insert on our lesser trochanter. And so as we're pulling this insertion up towards our origin, we're going to flex our leg. Great. Okay. Then we also have our gluteus medius. It does two functions, two very important functions, where it is the only muscle that does these functions, right? Abduction and internal rotation. So gluteus medius is the boss of both of these two motions in our hip. And when we abduct with the gluteus medius, I like to think of the supraspinatus. So remember how the supraspinatus was so far up in our scapula that when it pulled its insertion close to its origin, it swung our arm out? The hip, it does very much a similar thing here with our gluteus medius. It's so far proximal on this femur that it's just going to swing our leg outward. Okay, so that's going to do abduction. And Then we're also going to do internal rotation. And I'm going to stop here for 1 second and pull up complete anatomy because I don't know about you, but that does not seem very intuitive to me that it does internal rotation. We know that the gluteus medius will insert from the, let me present one more time. The gluteus medius inserts from the lateral surface of the ilium to the greater trochanter, right? So it doesn't really make a ton of intuitive sense for why it internally rotates. So what I'm going to do is pull up complete anatomy and show you all an example of when you can use complete anatomy to confirm and add to what you're learning and make sure that it's part of your study tools. So let's pull up this. Okay. So here on this complete anatomy screen, all I did was I just took the skeleton, our good old friend, and I added the gluteus medius. So you can see it right here, that lateral ilium, and then our greater trochanter. Okay, so those are our two attachments. And of course, we can see the motions. I don't know if I talked about this last week, so I want to make sure I show you all again. We talked about it a while ago, I think in lab 3, that you can use complete anatomy to show motion. So if you're looking at a muscle, this little button will pop up that says motion. You can click that and it'll show you the 2 or many or 1 motion that that muscle does. So if I go ahead and click abduction, we can see what we would expect. If it loads. I think it's loading. Oh, there it goes. Okay. Okay, I'm sorry. Okay, so abduction, right? This is taking our leg out to the side, abducting it. And we can see that really clearly. Now, another thing we can see here is they just added all these other muscles in. And I think that's a good example of how a lot of times muscles do not work by themselves. So they put in those other muscles to show us that they're going to be doing some work to help with that abduction. Or they're going to be moving around it. And then if we pull up medial rotation, might take a second. Yep, okay, there we go. So here we have some medial rotation. And again, we can see that this muscle, this gluteus medius, is not working alone. Our lab text has really consolidated the major functions of each muscle, but here we can demonstrate how the gluteus medius will internally rotate. Does that make sense? And again, I do not think that this is an intuitive motion, but what I want to make sure everyone understands is how to use complete anatomy to check motions, actually see them happening in real time. So, okay, did that help a little bit? Maybe, hopefully. Okay, let's jump back here. Am I sharing my slides?
Yes.
Yes, okay, thank you. Okay, so we did the gluteus medius. Now let's talk about the antagonistic function to that internal rotation. So we have these muscles called our deep hip rotators, and this is a little bit more intuitive, I believe. Their attachments actually demonstrate they would externally rotate or laterally rotate. Does anyone have any intuition as to what muscles these look like from the shoulder? What do they kind of remind us of?
Looks like the rotator cuff.
Exactly, yeah. It looks like the rotator cuff muscles. And funnily enough, it does what the rotator cuff muscles do, right? It externally rotates, or at least a few of those rotator cuffs. So this is a really good example of that parallelness that we see. Parallelity, I don't know what the word is. Okay, and then the last one we have is the adduction muscles. We have 5 different muscles here, a lot of bulk when it comes to adducting our leg. And the really interesting thing about the adductors is where the bulk of the muscle is. So they're kind of an upside down triangle in terms of the other types of muscle we look at. So if you see like the gluteus medius, it's this triangle with the, like this, right? But here with our adduction, we have the bulk lower, okay? So keep that in mind. The bulk of our muscle is a lot lower. And this is going to be our insertion. This is going to be our origin. Does anyone remember where all of the adductor muscles originate?
The pectineal line.
So there's one that originates on the pectineal line. Do you remember which one that is?
The pectineus.
The pectineus, great. The pectineus originates on the pectineal line. And what about the other 4?
That I do not know.
That's okay. Does anyone else know where the other 4 originate?
Is it the pubis?
It is the pubis. More specifically, it's going to be that inferior ramus. So remember, the pubis is kind of shaped like this. We have the superior ramus and the inferior ramus. So it's going to be on this lower one. And when I say the other muscles, we have these 3 adductors. We have adductor brevis, adductor longus, adductor magnus. And then we also have this muscle that runs right along the medial side called our gracilis. Okay. I believe in the lab text, all you're basically required to know is that they all insert on the posterior medial femur. So medial femur in this region, posterior, so you don't see any insertions on the front. But I do think it is important to know the order. So we have pectineus first, then we have brevis, longus, magnus, in alphabetical order, if that helps you, and then gracilis. Okay. Last thing to note about this, and I think I've kind of said this in several different ways now, we have all of these muscles, and they're really big, bulky, strong muscles because we have to move our big legs to get places. We have to locomote, right? Our arms don't really have to do that. We don't typically walk around on our arms. You might, but that's not typically something we do. So we have a lot of strength in our legs to help do this motion. So obviously the bulk of our muscles in our body is going to be in our legs. Okay, it looks like we're time for case 2. So we can do that. Does anyone have any questions before we jump into case 2? And this will be the last case that we do. So don't worry about the don't worry about this activity yet where you have to fill things out. I think we'll kind of have that as a take-home activity if you would like to do that, since we're kind of doing something similar in class. And before we even start this lab, before I go ahead and open the breakout rooms, I want to open up the complete anatomy screen and clarify a few things so that we are all set to go. Share screen, complete anatomy, loading. So slow. I don't know if I've told you all this, but I have recently discovered Play-Doh as something that I really like to have on me while I'm studying, just because I'm a very fidgety person, and it's just nice to have something in my hands to focus a little better. So I thought I'd make a little model out of Play-Doh and a pencil to demonstrate what's on this screen as well for us. And I'm not going to give you too much. We'll come back to this question if you all have concerns about it, but I want to first clarify stuff so that we're not just throwing ourselves into the wind on this one. Okay, bear with me here. This is our leg. Okay. And it's the same leg that you can see on the complete anatomy screen. This is going to be our greater trochanter, and this is going to be our lesser trochanter. And if you can see, I broke this pencil in half, which is going to be representative of this intertrochanteric fracture. Okay, it's cracked right between the greater trochanter and the lesser trochanter. So the case is going to ask you, I know you all haven't seen it yet, but the case is going to ask you to think about what does it mean to the function of muscles that insert at different portions in relation to this fracture. So I want you to think about what I'm saying and really apply it to the case. So when you're looking at this question, think about the insertion of a muscle in relation to the fracture. Is the insertion above the fracture? Is the insertion below the fracture? And I put the greater trochanter and the lesser trochanter as examples of insertions, right? We know a lot of muscles insert at the lesser and the greater. So think about that. Is it going to be at the greater trochanter, which is above the fracture, or is it going to insert at the lesser trochanter below the fracture? Okay. We'll come back to that in a second. Hopefully that gives you a start. Let me go ahead and open the breakout rooms and you'll be set to go.